Good morning, guys. Welcome to today's presentation with me, Cindy at HearCam and Nelson YouTube channel. So in today's discussion, we are going to look at measles. So if you are seeing this lesson for the first time and if you are enjoying the lessons that we are having at HearCam, please go ahead and subscribe, like, and share the lessons. Yes, so let's continue with our discussion today. So we are going to look at a past paper question in pediatrics under measles. So the question says, there has been an outbreak of measles in your catchment area. However, the immunization activity has reduced from 95% in the year 2007 to 55% by mid-2010. So mothers have been reporting that males are not supportive in such activities as under 5 clinic and reproductive health. So remember that when it comes to pediatrics is compulsory questions. So whether you like it or not, you have to prepare adequately for your pediatrics. So in today's presentation or discussion, we are going to look at a past question under measles. So we are going to define. So the question says, define measles, then write 5 points you would put in place in order to improve male participation in under 5 activities and reproductive health. Then list 5 signs and symptoms that children with measles will present with. Then discuss the nursing care for a 5-year-old boy who has measles. Then state the complications of measles infection. So we have been given a scenario, and out of this scenario we have been given these questions. So in this discussion we are going to answer these questions plus some bonus points on treatment, yes, and prevention also. So let's move on. So introduction. Under introduction, we are saying measles is a childhood infection caused by a virus. Now, it can also occur in adults, but it's very much common in children because once one is infected with the measles virus or they are immunized against it, their chances of having this infection is reduced. That's why it's more common in children because they are not yet exposed to the virus due to lack of acquired immunity. So measles can now almost always be prevented with a vaccine. So when a child is vaccinated against measles, they nearly cannot have the infection because they have the immunity. So measles is also called rubella measles, which spreads and can be serious and even fatal for small children. So measles is very much dangerous when it comes to children. So according to the World Health Organization, world death rates have been falling worldwide as more children receive the measles vaccine. The disease still kills more than 200,000 people a year, mostly children. So we see that even despite the vaccine being available, children are still dying from the virus. So now, coming back to our question, let's define measles. So measles is an acute, highly contagious infection which is also called rubella. It is caused by a virus called rubella virus, and it is transmitted through respiratory droplets and close contact with an infected person. It is characterized by body rash, fever, and red eyes, which is also called conjunctivitis. So this is how we can define measles. Always remember that it is an acute, very contagious infection which is transmitted through respiratory droplets and close contact with an infected person. So it is characterized by body rash, fever, and red eyes. So as we saw, this is the severe form of measles, and the rash is there. So this is how the rash looks like, and you can see that this child is even scratching, meaning this rash is also itches. So now, according to the question, it was saying state or describe measures which can be put in place to improve male involvement in under 5 activities and reproductive health. So here are the answers. So 1, we want men to be involved in under 5 activities of their children and in reproductive health. So what can we do to improve male participation in these activities? 1, we want to intensify health education. So intensify community teaching about the importance of male involvement in health activities or programs. So we want to make sure that we teach the community the importance of male participation in these activities. Then inform the communities that it is important for males to know their children and spouses, as they are a major decision um, makers. So it is important for the males to know the health of their children and of their spouses, and they can only know this because by being involved in these activities. So it is important for males to know their children and the spouse health. This is because they are the major decision makers. So males should be educated in the community that they need to know the health of their children and their spouses. So also inform the communities that reproductive health is not for women only, but also for males. So we also want the males to know and understand that reproductive health is not only for females, but also for males. Then also try to make children's health programs and reproductive healthy gender balanced. So we want both males and females to be participating in reproductive healthy activities and in their under 5 children's health. So these both partners, males and females, mothers and fathers, should be involved in these healthy activities. So all this is under intensifying health education. So number 2 is we have to involve the community leaders. So involve the community leaders. So involve the community leaders in sensitizing the community about the importance of male involvement in reproductive health and under 5 programs. So as we are targeting the males in the community, we can do well to involve the community leaders, because most of these community leaders are even males. So when males in the community are able to see their leaders being in forefront of teaching them or encouraging them about participating in health activities, they can be encouraged to participate as well. So this may encourage men to change um, their perception about reproductive health and under 5 activities. Notice that this word is supposed to be about and not and. So this may encourage men to change their perception about reproductive health and uh, under 5 activities. So second point is that there is need to training of male community health workers in collaboration with other stakeholders. So when it comes to community health workers, not women should not be the only ones who are involved in these health programs, but males should also be included in being trained as community health workers. So, training of male health workers to work in reproductive health activities and under 5 clinic activities would help to motivate male folks to participate also. So you'll find that sometimes males shun away from going to the clinic because they feel or they think that they will just found female health workers, and sometimes even if they have a reproductive health problem, they may feel shy to talk to a female nurse or a female health worker. But when they find that they are also men, they can open up easily to fellow men about the problems that they may be having in their reproductive health. So it is important that there is male training in community health. So it is important for males to also be trained as community health workers. So fourth point is that we have to discourage negative comments from health personnel towards male parents who bring their children for under 5 clinics. So we want to make sure that as health personnel, we are avoiding discouraging comments, because if male parents, if fathers come for under 5 and then we are not encouraging them, or we are saying things that are going to discourage them, it means that next time they won't even come back. But we want to make sure that we encourage them, we give them positive comments so that they are encouraged, so that next time they come back, or they are always looking forward to come to the clinics or to the hospitals for their under 5 activities or for reproductive health. So this is for health care workers. Always make sure that we bring out positive comments um, to the male parents so that they are not discouraged. So also we want to make sure that we are not turning them away, the males who come for reproductive health issues. So if males come and they find that you are a female health worker who is present, or you are also a male health worker who is present at the facility, we shouldn't turn them away to say no, maybe you come back so that you talk to your fellow man when they come. No, we shouldn't turn them away for any reason. We should attend to them, hear their concerns, and provide the healthy services that they need. So reproductive health and child and under 5 clinic activities should both should reproductive health and under 5 clinic activities should have both males and females as health personnel. So this point simply means that both males and females should be present to offer these health activities for under 5 and for reproductive health. So we shouldn't say only female health workers should offer under 5 clinic activities, or only males, but both parties should participate in these activities. So the fifth point is that health workers should give positive reinforcement for males that bring their children for under 5 clinic, and those that come with their spouses for reproductive health issues. So when a father brings their children for under 5, we should enforce positive comments. So we should enforce positive comments so that next time they come and they do not shun away because of the negative experience that they may experience at the facility. So it is also encouraging to attend to the meals. Sometimes you can be at the facility and you notice that there is a male parent, a father was brought a child, and there are a lot of women also. Sometimes because we want to encourage them, it is also nice to attend to them early. So when we attend to them early, they are going to be encouraged because they are not going to be in the queue for a long time. So when they notice that we are putting in efforts to encourage the male folks to be coming for these activities at the facility, they will also be encouraged to start participating in these activities which involves their reproductive health and their children's health. So those are the 5 points that we can implement in order to improve the male participation in under 5 um, health activities and in reproductive health. So let's move on. The other question was saying states list the signs and symptoms of measles. So the signs and symptoms of measles appear around 10 to 14 days after exposure to the virus. So they also occur in stages, but because the question was not specific, we are going to go through the signs and symptoms, the general signs and symptoms. So this includes fever. So fever is due to the presence of the virus in the body. Then there is also a dry cough. This is due to the irritation of the virus in the respiratory system. There is also the run nose. Remember that this infection is transmitted through respiratory droplets. So the respiratory system is the main system which is targeted first. So there is inflammation which goes on in the respiratory system, which is evidenced by the signs and symptoms. So there is also a sore throat which comes about due to the presence of these viruses on the sore throat. Then also there is red eyes, there is inflammation of the eyes, which is called conjunctivitis. So this will be evidenced by the eyes appearing red. They are going to be inflamed. So there is rash in the ear, rash in the near cheeks, known as the coplic spots. So when you look in the mouth, you'll be able to see this rash, which is inside the cheeks, inside the mouth. So then the body rash starts from the back of the ears and the forehead, which later becomes generalized. So the type of rash starts from behind the ears, then it comes in front, then later on it is generalized to the entire body. So this rash may even peel off. Let's look at the picture. So like this rash has finally even peeled off when you look at this child who had severe form of measles. So this rash started from behind the ears, then comes on the forefront, then it goes on the entire body. So even from this picture, we are able to see this rash. So it means it started from behind to the forehead, then the entire body. So that's the cardinal sign which tells us or shows us that this child could be having measles. So just more information on this, the coplic spots which are found in the mouth. They're saying they are tiny white spots with bluish white centers on a red background found inside the mouth on the inner lining of the cheek. So this is how the coplic spots looks like inside the child's mouth or the patient's mouth. They are tiny white spots with bluish white centers. So also a rash made of a large flat botches that often flow into another one. So this is where if the rash can fall into another one, and then it may form like this, as we are able to see. So those are the signs and symptoms of measles. So the question was not asking about the risk factors, but for the sake of our knowledge, and maybe another question can have risk factors, let's just look at them. So the risk factors for measles are as follows: being unvaccinated. So children who are not vaccinated against measles are at high risk of having measles. Then internationally traveling to places or areas where measles is very much common, where measles is endemic, you're at high risk of having measles. So if you travel to countries where measles is more common, you are at a high risk of catching measles. So having vitamin A deficiency. So if you do not have enough vitamin A in your diet, you are likely to have more severe symptoms and complications of measles. So this is why children are given vitamin A supplements. And so it's also important to include vitamin A food supplements in our children's diets. Then also becoming in close contact with a child or an adult who has measles. So that's why we nurse these patients in isolation, because we want to prevent the spread of measles. So this child is being vaccinated against measles. So if a child is not vaccinated with measles, they are at a high risk of developing measles. So now when it comes to medical management, the question was not asking us about the medical management. Just for the sake of knowing, the sake of having full knowledge, we are going to do a history taking in physical examination. So during history taking, we'll show the onset. First of all, the risk factors such as the child has not been vaccinated, or the child is living with someone who has measles, has been in contact with someone who has measles. Then also the signs and symptoms, the onset. So the mother or the father will be able to tell you that the rash started from the ears, from the forehead, or you'll be able to see that the rash is starting from behind the ears, on the forehead. So during history and physical examination, you are able to see the signs and symptoms and the risk factors. Then blood for serological testing can also be done, which can show the antigens for measles present in the blood. Then a nasopharyngeal swab. Remember, the child also has a sore throat, so a swab can be collected on the throat and the urine samples to detect the presence of the virus. Then when it comes to treatment, there is no specific antiviral for measles. Therefore, the symptoms are managed accordingly. E.g., if the patient is having fever, paracetamol is going to be given. So remember that medical management, when it comes to treatment, is going to be done according to how the child is presenting. So for example, if be given fever, we are going to give paracetamol. If the child is having some oral thrush, sore throat, you're going to give drugs according to the symptoms. If they're having difficulties in breathing because the respiratory system is affected, we are going to administer oxygen accordingly. So the management is according to the symptoms. So now the question was asking us about the nursing management. So let's look at the specific nursing care that you're going to give to this child who is 5 years old. So the aim of the nursing management is to prevent the spread of the infection treat the symptoms accordingly, and prevent the possible complications. So when it comes to the environment and the isolation, because this is very contagious, we want to make sure that we isolate this patient. So the nest the child in isolation to prevent the spread of the infection. So that's under environment. We are going to isolate this child from other children with other infections to prevent cross infection or the spread of the infection. Then also we are going to nest this child in a dark room to prevent eye straining caused by photophobia. Remember that the eyes of this child are also inflamed, so they may have photophobia. So we want to make sure that we prevent eye straining by nesting them in a darkened room. Then nest the patient in the warm room by switching on a heater or closing nearby windows to prevent hypothermia. So the other point is that if the patient is having fevers, we are going to switch off the heaters and open the nearby windows to promote heat loss. So we are going to manage fever accordingly. So then we are also going to nest this child in a quiet room to promote rest by eliminating all sources of noise. Then we also want to maintain infection prevention measures such as the wearing of gown when attending to a child, regular hand washing and decontaminating of all the equipment used to prevent the spread of the infection. So we are going to make sure that we maintain all infection prevention measures to prevent the spread of the infection. Then we are going to ensure that all relevant authorities are notified for necessary action, as we know that measles is a notifiable disease. So so I want to make sure that all the authorities are notified accordingly. Then when it comes to observations, we are going to make sure that we monitor vitals every after 4 hours to detect any deviation from normal, such as fever, so that appropriate measures are taken. So if fever is present, we are going to carry out the measures to reduce it, such as tepid sponging and removal of excess linen and clothing. Then we are also going to administer the uh, pre, prescribed antipyretics such as paracetamol to reduce the fever. Then we are also going to observe the pattern of the rash to note whether if it is subsiding or increasing, so that appropriate measures are taken. We are also going to observe the general condition of the child to note if the child is responding to treatment or not, so that if there is any need for adjustment in the treatment, we do that. So when it comes to nutritional status, nutritional support, we are going to assess the nutritional status of the child by weighing and using the body mass index, the BMI. So we want to make sure that the child nutritional status is not neglected, because it could be the reason why this child is also having measles, because maybe the immunity is low because of poor nutrition. So then we also want to assess the feeding patterns. If the child is unable to feed by his own due to maybe oral thrush, mouth rash, which is present in the mouth due to the disease process, we are going to insert a nasogastric tube for feeding. Then after we insert a nasogastric tube for feeding, we are going to be feeding according to the doctor's orders, such as 150 meals every after 3 hours to promote the food intake, thus improve the nutritional status of the child. And then we also want to make sure that all the feeds that we are giving, we record all the oral feeds on the feed chart to monitor strict inputs and outputs. Then we are also going to administer fluids, because this child can even have diarrhea, which can also cause dehydration. So we are also going to administer this the prescribed intravenous fluids such as dextrose or normal saline to correct any dehydration and provide energy. So if the child is unable to feed, is able to feed on their own, so we are going to give them small but frequent meals to prevent vomiting. Then we also want to give the child his favorite food or meals to promote appetite. So when it comes to eye care, remember that this child has got eye inflammation or conjunctivitis. So we want to assess the severity of the conjunctivitis. If pus is present, we are going to clean the eyes with a cotton wool dumped in cool bottled water to promote healing and eye hygiene. Also, we are going to administer the prescribed eye drops to promote quick recovery. If the child has been put on any eye drops, we are going to administer them accordingly. When it comes to oral care, remember that this child has got rash in the mouth, so we are going to clean the mouth with clean salted water or saline solution to promote oral hygiene and prevent halitosis. Then also we are going to avoid giving of spicy or hot foods to this child to prevent further injury to the mucosa membranes in the mouth. Then we are also going to provide daily body hygiene to promote hygiene. So after the child is discharged, we want to make sure that we damp dust after the child has been discharged using jig or Lysol according to the strength detailed. So even before the child is discharged, we are going to be damp dusting every day this environment to prevent bacterial colonization. Remember that this child is also prone to acquiring hospital acquired infections such as pneumonia. So we want to make sure that even in the environment which they are in, we are cleaning it daily. So when it comes to the information, education, and communication, we want to educate the parents on the importance of giving vitamin A supplements to the children. As we can see in this picture, this child is receiving his vitamin A supplement. Then also want to teach the parents about how to prevent measles. The importance of vaccination should be mentioned to the parents. Also teach the parents on the importance of review date. So the parents should be encouraged to come back for review so that the child is assessed accordingly. So also the importance of good nutrition to boost the immunity system should be emphasized to the parents. Then teach them the importance of Who Under 5 clinic. So the last part of the question was about complications. So the following are the complications of measles. We are going to, the child can have diarrhea and vomiting. So this diarrhea and vomiting can result in losing too much water or body fluids and electrolytes, which can result in dehydration. So this child can also be dehydrated. Then ear infection, which is also called otitis media. So it is one of the most common complications of measles. So this is why we're also going to give antibiotics to this child to avoid otitis media. Also bronchiolitis, bronchitis, rhinitis, and croup. So measles can lead to the uh, irritation and the swelling, which is the inflammation of the airway. So it can also lead to inflammation of the inner walls that line the many air passage ways of the lungs. So measles can also lead to inflammation of the vocal box. So these are the complications of measles. It can also result into pneumonia, so encephalitis, so all this blindness and um, corneal ulceration. So all these are the complications of measles. So this is where we end our presentation today. Hope you have enjoyed and you have learned a lot. So for all comments, questions, or the topics that you want us to cover, please you can write in the comment section and I'll be able to attend to them. So is your child vaccinated against measles? Thank you for watching.